हो गया वकील साहब इनको भीतर बैठाओ 2 मिनट के बाद
डॉक्टर रामजी सिंह ज्वाइन
So we are live.
हेलो
हाँ कैमरा ऑन कर लीजिए
कैमरा ऑन कर
हाँ कैमरा ऑन कर लीजिए
So we are live.
हेलो
हाँ गुड मॉर्निंग हाँ गुड मॉर्निंग put on your camera sir, put on camera.
Dr. Sahani will speak first.
Yeah.
No, sir, Dr.
I will not speak. I will only welcome you, sir. I will only welcome you, sir.
Yes, please. Go ahead.
Okay.
Thank you so much, sir, for joining, all of you. So let me take this privilege to welcome everybody to this webinar, mega webinar, in fact, I would say. So let me just begin with the webinar. I welcome each one of you to the Globinar on Homeopathic Repertory, Linking Medicine, Principles and Patients, organized by Homeopathic Science Congress Society in collaboration with Homeopathy 360, supported by Homeopathic Medical Association of India, Bihar. I, Dr. Yashika Arora, heartily welcome you all, and I'm privileged enough. I feel privileged enough to be a part of this session, I would say. So I would like to begin this webinar with a saying: great leaders don't tell you what to do; they show you how it's done. So we have we have a Globinar. We have organized a Globinar today where we have gathered so many great speakers with us, and I hope everybody is excited to learn from all of them. And we are glad that many of us, you have already joined us. So thank you so much for joining us. I, Dr. Yashika Arora, is grateful to all these speakers on behalf of Jain and Homeopathy 360, as well as Homeopathic Science Congress Society, for collaborating and making Homeopathy 360 a part of this webinar, and also Homeopathic Medical Association of Bihar for being with us. I heartily welcome Dr. Farokh Master, sir, Dr. Frederik, Schroyens, sir, Dr. Amit Sahani, sir, and Dr. Ramjee Singh, sir, as well as Dr. Amit Sahani, sir, and Dr. Sanjiv Kumar Singh, sir, who will be joining us soon. So before before we begin this session, I just want to thank Mr. Manish Jain, also the director of Jain Publishers, who is behind this webinar, as well as Dr. M.K. Sahani, sir, who has organized all this and his strategy, whatever he planned, and has executed well. So I thank everybody, and I want to welcome Dr. M.K. Sahani, sir, and his. I just want to introduce everybody. As you all know, that Dr. Midul Kumar Sahani, sir, has completed his PhD from MUHS and is the first PhD holder in the state of Bihar. He has worked under Dr. B. Sahani, sir, a recognized scientist and discoverer, transmission of medicine energy from a distance. He is former chairman education committee at CCH, and he was former member education committee for approximately 22 years at CCH New Delhi. He is also holding the position of president at Bihar Voluntary Health Association, serving his third term, and secretary at Voluntary Health Association of India, serving his second term. He is also the chairman of Research Institute of Sahani Drug Transmission and Homeopathy, and also one of the founders. He is also a scholar of transmission of drug energy from a distance. He is a PG coordinator, professor HOD at GD Memorial Homeopathic Medical College, Patna, and also chief editor of Journal of Homeotransmission and Homeotarang, Patna. He's a visiting professor at Homeopathic Medical Colleges in India, and also secretary general at Homeopathic Science Congress Society, and NABH trained under various Ayush hospital and institutions. He's an expert panelist and reviewer of syllabus for conducting recruitment of homeopathic faculties and medical officers as expert at Public Service Commission, Allahabad, UP. He has presented so many papers at international as well as international level, and is a and holds various awards during his lifetime, like Kent Award by HMAI, Hahnemann National Award in Academic and Professional Excellency by Hahnemann Memorial National Society, Lifetime Achievement Award by various associations, and various numerous awards. He's also an author of Organon of Medicine, Graphical and Commentary, and also an author of Art of Practical Case Taking in Homeopathy, and many more books, and also publication of various articles in magazines and journals. So we welcome him, and I also would like to hand over the session to him for the further proceedings. So over to you.
Thank you, Yasika ji, for your big and nice introductions about me, and welcome to you all. Welcome to you all, and good morning, good afternoon, good morning to Dr. Frederik sir, and good afternoon to all our Indian delegates. Today I am privileged to welcome the most distinguished personalities of the world, I say the world, and most esteemed international repertorian Dr. Frederik Schroyens sir, Dr. Ramjee Singh sir, President Central Council of Homeopathy and ex-President Central Council of the Homeopathy, President of the Homeopathic Medical Association of India and ex-President of the Central Council of Homeopathy. He is also the chairman of our Homeopathic Science Congress Society. And today we have the resource person and the world-renowned resource persons, Dr. Farokh Master sir, also with us. He will be enlightening us with many of the aspects of the repertory. We have learned too much from him. We have shared so much experiences from him. So it is very nice opportunity for me to be with you all. I welcome Dr. Sanjiv Kumar Singh also, and Dr. Amit Sahani also, who will be joining just now. Friends, Dr. Frederik sir, today we are reminded about your live presence during our annual Homeopathic Science Congress in 2006 at Patna. I hope you remember, sir. We all still cherish memory of being enlightened with your most valuable teaching. Today, with your presence, we are again filled with the joy. And Dr. Farokh sir, we also met you at many of our own seminar at Homeopathic Science Congress. I remember last year you were the savior for us last year, and so we are reminded. Our society has been working for the promotion of scientific practice of homeopathy and continued to spread the message ever since our inception. Homeopathic Science Congress Society was formed by the inspiration of our founder, Dr. B. Sahani, who himself practiced homeopathy through the repertory. He is acclaimed to be the promoter of repertory in those eras when it was a very rare things to practice through the repertory. His understanding with the Kent repertory was deep rooted within his heart. Today and tomorrow, our speakers are representing the cross section of repertory, right from the young generation to the topmost repertorian of the world universe, international speakers. So, and tomorrow Dr. S.K. Tiwari will also be joining with us. Subject of repertory occupy the most prominent position in teaching at graduate and postgraduate level in the Indian educational system of homeopathy. Now, students entered into the arena of the PhD with repertory at different universities in our country. This Globinar will prove to be the messenger for all homeopathic practitioners to follow the teaching of Dr. Hahnemann in most sincere and repertorial way. I once again welcome you all, and I am confident all participants will find it to be the most satisfying moment learning repertory from the learned speakers of this webinar. And with this, I am inviting our first and inaugurator, Dr. Frederik sir, to make a presentations. And before he starts, I'll give you a brief introduction about him also. Dr. Frederik Schroyens, he was born in January 1953 at Mechelen in Belgium. Frederik Schroyens did his medical graduation in 1977 from the State University of Grand Belgium, and in 1978 he became graduate of the one-year homeopathic training course at the Faculty of in London. In 1981, Dr. Frederik was the constitutive president of VSU, the largest homeopathic school in Belgium. VSU had given a one-year introductory training on homeopathy to more than 1,000 students and fully trained over many of the homeopathic practitioners around the globe. The homeopathic education is built up over 5-year program. He also founded the Massey workshop in Belgium and in Holland. Dr. Schroyens was one of the first radar users in 1986 and became an enthusiastic about increasing possibility of computer science offered to the homeopathy. Because of his dedication to the program, he became the homeopathic coordinator of the radar project. In 1987, he was appointed as the main link between the George Withelkost and the programming team of the University of Namur, Belgium during the development of Withelkost expert system. He has been accompanying George Withelkost on his seminars since 1988, as well as assisting him during most of his consultations since that time. Dr. Schroyens has published an introductions to homeopathy in 1984 in Dutch, which has been translated into French and Portuguese in 1993. He edited and printed versions of synthesis repertory, standard repertory linked to the radar project. A computer version of synthesis exists in 7 languages. This repertory has also printed in German, English, Dutch, Italian, Spanish, and Portuguese. Translation into various other languages are going on. Since 1995, Dr. Schroyens has published several books based on synthesis, such as 1,000 Small Remedies. Very wonderful book that I have gone through the about the rare remedy, rare understanding of the large remedy, polyglot remedy. There only I learned how the sulfur can be the rare remedy and how the sulfur can be utilized as a large remedy. Dr. Schroyens, sir, this is a most satisfying and learning moment from you. You are an evergreen aspirer for all of us. And with this, I welcome you, sir, and request you to inaugurate this Globinar with your kind words.
Thank you. So do we have something with 2 minutes of light, or shall I speak?
So, as you feel fine, you can start.
As you feel, yeah.
Okay. So first of all, thank you very much for the introduction. Your key persons, Dr. Sahani, Dr. Ramjee Singh, they know I have visited them. I still remember being in your college, in your house even. It's all very nice memories. And I am very happy that you organize this weekend on Repertory. Because as you say, it's been my lifetime job to work on Repertory, with the help of many people, of course, but it has been my lifetime job. And when I was asked to prepare some kind of introduction, some inaugural speech, I reflected about this idea that, yes, of course, many people use Repertory and they have very good successes, etc. But I believe there are still quite a few people who don't use the Repertory at its full potential, or who don't use the Repertory at all. And so I was wondering about this introduction to speak about the reasons to embrace the Repertory. also all the people that are new to our profession, shall they embrace the repertory? This is the topic I would like to highlight during this short introduction to your most interesting webinar, which is covering, of course, the repertory in many ways with contributions, as has been explained. You see in the back of me, you do see the books. Do you see the books? Yes?
Yes.
So I checked, I turned around, and the one book which you can maybe not see very well, all at this side where my finger is the book of Dr. Tiwari on the repertory. So I know you have the people there which will give you the knowledge on repertory. So it's very interesting, your program. And so the question that I think we should not avoid is, in fact, do we need a repertory? Does anyone need a repertory? And a repertory is just an index. And you may know this is the reason why I chose the name synthesis. Because the index means we synthesize all people can know in the homeopathic community. And we give an index so you can use the knowledge. Okay, this sounds fine. But many people say, well, wait a minute, because I have a very good memory. And I must say, I have the same. I had a very good memory. It's maybe a little less than before. But I had what they call a visual memory. And just like many others, I could say, this rubric, jealousy, is on the left page of Kent's repertory in the left column in the middle. Or I could say this rubric is on page 1 to 75, and the remedies in bold are this and this and this. Because I saw the pages, very precise. I saw the rubrics, I saw the remedies. And like this, as many of us at the time, in my mind, I knew hundreds of remedies and rubrics by heart without needing a repertory. So the question is, some of you may have a much better memory than me. If we know these rubrics, these remedies, do we need a repertory? Or to rephrase it even in another way, if you have a very good memory and you read Berica, Materia Medica a few times, and you remember very quickly all these remedies, and when someone comes with ascites, you know which main remedies to think of, but also which small remedies to think about. Do you need a repertory when you have such a good memory? And here is what I would like to say when this question is asked. What can you do with a repertory? The first thing is, when you have a patient, every time I will use an example to make it very precise and concrete. So when you have a patient who has a fear of spiders, those who have gone through the training, and even more those who have experience, they will remember Abel Moscus, they may think of Calcaria, they may think of Ignatia, or they may remember the tarantula, which is the spider having the fear of spiders. It's an easy way to remember. But my question is, will you remember the 23 remedies in the rubric? The magnesias, for example, will you remember all of them? Okay, so maybe it's interesting to use the repertory to find the other remedy that you don't remember. And I would like to say that this reason becomes even more important when the rubric is a little larger, like affectionate, very interesting symptom. And of course, you can maybe say 5, 10, 15 remedies that are affectionate, but will you be able to remember, for example, the heroinum, the 94 remedies, the hura, even the platina, to be affectionate when you prescribe? So this is the reason why I suggest to use the repertory, to be reminded of the other remedy. Okay? Now, when the patient comes to you again and has a symptom such as the desire for company, from the story, you hear that this patient behaves not like everybody else in company. So you say they like to be in company, they want to be this, they are different when there's company. So you think about the remedy, desire for company. And as you can see, it's a big rubric, 168 remedies. You can remember the lycopodium and many more remedies that are there. Will you remember the 168? Not me. But now the repertory can be used to find another rubric. And in synthesis, we have several ways that lead you from one rubric to another. Cross-references, which was already existing in Ken's repertory, then also conceptual access, which makes groups of symptoms in a more abstract way. It's like a spider web over the repertory, which leads you from one symptom to another. And I'm going to go through an example to clarify this to you. The cross-references to desire for company are the lines in blue. And you go through it and you say, oh, is it maybe that this person desires for company because they feel forsaken? It's more the forsaken feeling that is the symptom. So this is the meaning of a cross-reference, to use the more exact rubric. Forsaken feeling in this patient may be the more important issue. Okay? And you go through the symptoms, through the cross-references, and you say, cheerful. Yes, she lights up. This lady lights up. Cheerful in company is the more appropriate rubric, more precise rubric. And then when you come at cheerful in company, you will see cross-references. And there you see, well, close to cheerful in company, there is another rubric, which is excitement in company. There is excitement, not cheerful, like happy, joyful, it's excitement. And you say, well, exactly, this is what this patient is telling me. This is what we are observing, what the family tells me. It is excitement in company. So from using the cross-references or the conceptual access to the repertory, we have come from company desire to excitement in company. And of course, a different rubric has different remedies and may help you to find a different prescription. Because that's the other thing we will like to do, is that the repertory is interesting to find one symptom and read the remedies, but it's even more interesting to repertorize as we say, and this can be done in many ways. And I know in India, many times you don't have time. We know it. But listen, are you aware that even these three symptoms, which you see on the screen here, the fear of spiders, the being affectionate, and the excitement of company, it's enough. It's enough to have a first idea of a remedy maybe you were not thinking of. And I request from you, you who know maybe the repertoire, the materia medica so well, all the fear of spiders remedies, the affectionate remedies, you cross them in your mind. You repertorize whether you're thinking of fear of spiders, affectionate, maybe calcarea, whatever. No, don't worry. Just take these three symptoms. Taking one symptom is half a minute in the repertory. Mind, fear, spider. Mind, affectionate. Mind, excited, company. It's 3 times half a minute. And then when you found these 3 symptoms, it takes you literally 1 second to find the other possible remedy, to repertorize the case. And then you see the calcarea is there, but it is the excitement in company, the more precise symptom as compared to the desire for company, that tells you, consider the possibility of lecitinum and sepia. And then when you read the materia medica, which is always the next step, you consider, you conclude that lecitinum is the remedy. Lecitinum is the remedy that perfectly fits this patient. Okay, this may be the conclusion. So the repertory, you can make a repertorization very thorough with 10, with 20 symptoms, constitutional picture. But even with 2, 3, 4 symptoms, maybe a remedy pops up you've never been thinking of. You wouldn't be able to find the other possible remedy. And of course, there is in the mind of many people maybe the idea, but if lecithinum is the remedy. How can I be sure? I say read the Materia Medica, and I would like to remind you that the repertory is like the other Materia Medica. We can extract all the symptoms of lecithinum from synthesis in this case, and we have 286 symptoms of lecithinum structured by chapter, and in a very quick way, in a very precise way, you are able, in this example, in this screenshot, to look at the mind or to look at the back chest extremity symptoms, if that is of interest to you. You can very quickly know what are the highlights with the degrees as well. So lecithinum apparently has a hypochondriacal problem, okay? It's in 3rd degree. So the repertory is also a reverse Materia Medica and can show you very precise pictures of remedies whenever you need them. Then at last, I would like to tell you, well, you want to investigate, you want to study. We study all the time. I still study cases, remedies, reading articles, every week, every day. We continue to study all the time. And when we come across a remedy that we don't know very well, we want to study it. And so the repertory can also be a teacher. Now, in fact, how you can use the repertory, and then especially the software versions, if I may say, to help you learn about homeopathy, we could speak a whole weekend. There are so many possibilities to learn homeopathy using the repertory that I cannot include this in this introduction. And I would just give you one example. And that example is, I'm looking here at this remedy, lecithinum. Suppose this is a remedy not well known to me. So how can I remember this remedy? How can I find this remedy the next time? Because I see it only has 286 symptoms on the 180,000 symptoms in the repertory. How will I come across it? And one way to find a small remedy is to be aware to which other bigger remedy it can be compared. So you easily find a patient with lycopodium symptoms, okay? But if you know that Rauwolfia looks like lycopodium, then if you are not happy or you don't have a result with the lycopodium, you may think about the Rauwolfia because you know that this very small remedy looks like lycopodium. And then we differentiate. We differentiate the lycopodium with the Rauwolfia because the lycopodium has a desire for sweets and sugar and the Rauwolfia an aversion. And I'm going to show you a similar thing here with the lecithinum. How do we do this? How can the repertory help you to become aware when to use a small remedy linked to a bigger remedy? Well, we just select all these symptoms. You see the little squares here. We select all these symptoms and we push the button to repertorize them. And of course, as you can see here, lecithinum is the first remedy. It covers all the symptoms. Many times sulfur appears as the next one because it's just so, how shall I say, omnipresent and a bit overrepresented, I guess. You may wish to look into sulfur as compared to lecithinum, but when you go one remedy further, look at the phosphorus and look at the keynotes of phosphorus. You can see here that phosphorus, of course, has anxiety, is very anxious remedy, anxiety when alone. And these are symptoms that lecithinum has too. That the hypochondriacal anxiety of lecithinum, of course, is also present in phosphorus. That the desire for company of lecithinum is also present in phosphorus. That the confusion and dullness is there as well as the excitement in both remedies. That there are several fears, including the fear of spiders, for example. And so you begin to understand that you may make a note close to phosphorus. Phosphorus, if it fails, maybe think about lecithinum. And so the repertory has become your other teacher. Okay? These are just some examples why I believe it's interesting to use the repertory, to embrace the repertory, and to go even far beyond the few examples I have been giving. And I believe some of the people who will speak in this weekend will explain to you many more reasons to show you how homeopathy can become very efficient and very fast by using the repertory in all the ways that are possible. Now, as a last little paragraph in my lecture, I would like to reply to a question that I'm asked very often, and that is about the status of the new synthesis. And yes, it's true. It's true, there has been no new version of synthesis for a very long time. And I'm not going to elaborate on all the reasons why. It is almost 10 years now since the previous version of synthesis has been released. I'm going to tell you that we are now close to, how shall I say, resolving all the issues, including the creation of a new software, recreation of all the editing tools, etc., etc. And we are ready to release a new synthesis, we hope, towards the end of the year. This is our aim, the end of the year 2020. And I know many people have been impatient and have been waiting, and I thank you for your patience and especially for supporting our project in these times that we had to wait, that you had to wait for the new version of synthesis. But I can tell you, we have been continuing to work these 10 years with many people to continue and to, how shall I say, to add data. And what have we done? What do we do every new version of synthesis, in fact? Well, it's basically three things. We add new information, which means on the remedies which exist, but also means new remedies. Especially, we've been focusing on new provings, recent provings. Many of the new provings will be included in the new version of synthesis, which has received the name Adonis. Adonis is the Greek god of beauty, and we believe this synthesis that is coming is really going to be beautiful, very interesting and attractive, because of the new information, but also because of the corrections. Because, you know, in our project, there is no compromise on quality. We want to deliver quality as the first standard. And so corrections are welcome and will always be considered and always be integrated in the next version of synthesis. Okay? And the third idea is that every version of synthesis comes with some new ideas. In the very first versions of synthesis, version 2, 3, 4, 5, 6, etc., it was mainly streamlining, because, apologize to say, Kent did not have the computer tools we are having these last years, and there were many inconsistencies and many words. And just to quote a very easy example, some rubrics were saying blah blah blah, talking aggravates, and another one speaking aggravates, etc. So we standardized, we streamlined it to allow everybody to find rubrics more easily. So this standardizing of the language, the streamlining of the rubrics has been going on a lot and is still going on. We still want to improve the structure and bring new ideas to give you access to the information you like. Just to give you one other example of the new ideas that come with the different versions of synthesis is that at some stage, I believe it was version 7 of synthesis, that we have integrated all the Berger-Berningshausen information into synthesis. By the way, this was done with the help of one of your country fellowmen, Dr. Shivaraman. I think he is not alive anymore, but I'm very grateful for his big help during a few years that he worked with us to integrate the Berger and Berningshausen information in a very precise and transparent way. And so this was one new idea, the Kenyan repertory, like synthesis, integrated with the Berger-Bernninghausen information. And yes, I just want to little one thing in parenthesis. One speaker will speak about the therapeutic pocketbook. So I want to say that, of course, synthesis, the super repertory, has become very big, lot of information. And the title of this person was David and Goliath. I think it's a very good idea to speak like this. And I want to support this lecture very much, because I believe on one side, synthesis gives you the idea of all the information that is available, which means many, many remedies, many, many symptoms, many, many provings. But on the other hand, if you would say, if someone would tell me, make a choice, you from now on, you can only prescribe successfully 100 remedies. Then I believe, and I think many of you, I would prefer to be helped to prescribe the 100 most often used remedies. And in that case, the therapeutic pocketbook with the Bernninghausen approach, especially the approach by Heiner Frey with the polarity analysis, they are very useful and they have a place. They have a place in our practice, as probably this lecturer will explain. Now, for synthesis adonis, I'm not going to explain to you all the information, all the corrections, all the new ideas that are coming. You can imagine something is coming. I will just like to highlight two things, and that is basically that the input is there from Farokh Master. I mention him because he's a lifetime collaborator to our project. I meet him every year 1 or 2 times, most often in my house on congresses, etc., to tell you the collaboration is very close. And by chance, you will see it. It has not been agreed at all. He even used the same PowerPoint template than me for the lecture on this event. And I can swear to you, this was not agreed. So this statistically, totally unforeseen circumstance has happened. So you can imagine the collaboration that there is between Farokh and me. And one of the main points of the synthesis adonis will be that Farokh's clinical additions are being integrated today since several months already, and will be available as well to the community. And I'm sure he will speak about this in his lecture. Now, this is Farokh's very valuable contribution. Other people make contributions, large contributions. And I want to finish my lecture, my inaugural speech, by requesting every one of you who listens to say, please, contribute you too, contribute to this knowledge base. And of course, you may need a little, how shall I say, experience and time before you can confirm cures in patients and submit clinical additions. You may need time to set up approving and submit approving, etc., etc. But please, as soon as you have information, or even if you have been reading articles like this lecture about the epileptic symptoms, you read an article and you would like to make sure that this information is available in synthesis, contact us. And there's one email address where you don't reach me, but my team, so I'm not the bottleneck. So I ask you your input in this project by sending emails to synthesis@zeus-soft.com. So this is most of what I wanted to say. I don't know if you would like to ask some questions. If I have gone beyond my time, I'm not totally aware, but please guide me. What is the next step after this presentation?
WhatsApp.
I see one question. Is there a way to get an app of synthesis on the phone? There is a free app. I'm sorry, it is not free. This project, we are working with some 15 to 20 people, all of them who need to be paid. So we apologize if it sounds unreasonable, but we need to ask some money for the app, but it is available on iPhone and on Android. You can go to your Play in Google and to your iPhone shop. What is the name? iTunes, I believe. And you just type Schroyens and synthesis, and today you can download it and use it in, I think, 6 languages. The synthesis repertory is available as an app, and it is possible to send your information to your synthesis repertory on your computer. Okay.
Thank you so much, sir. I think Dr. Sahani, sir, has joined again. Sir, please on your video.
Yes, I hear you.
Dr. Sahani, sir. Sir, there is one more question. How to repertorize the case from Murphy's repertory?
Yes, what I say about the other remedy, the other rubric, the other possibility in the repertorization, etc., the extraction and so on, applies to all the repertories. Okay? And so we have a version of Murphy's repertory in our Radar Opus software, so you can apply it to Murphy's repertory there as well. All I say applies to all the repertories and all the repertory softwares. Radar software synthesis update is coming. It's 2 different things. I have been speaking about the synthesis update is the repertory itself. Radar Opus is the software to manage everything, repertories, materia medica, patient file. We had an update last year. The most current version is 2.2.16. And an update is probably, for version 3, as Radar Opus software, is probably also towards the beginning of 2021.
Thank you so much, sir. Sahani sir has joined. Sir, please proceed further. Sahani sir.
Yeah, thank you, Dr. Frederik, sir. It was nice, and I'm reminded with your last memory, where you talked about the word, sentence, paragraph, and the whole story. So you started with the words, you started with the sentence, and then you gave us the whole story. Wonderful, yes. Sir. Yes. Wonderful that from you. And your way of presentations was such a nice and inspiring for all of us. And I am confident that all the delegates, all the participants will be feeling very pleasant and satisfying things for today. Now, with this, I request our chairperson, Dr. Ramjee Singh sir, to just make the presidential remarks, and thereafter we'll ask Dr. Farokh sir to start his presentation. Dr. Ramjee Singh sir, please.
Thank you, Dr. Amit Sahani. Good afternoon, everybody. Host distinguished Dr. Frederik sir, all speakers of the webinar, dear doctor, teacher, student, PGT, admirers of homeopathy from all over the world. I welcome everybody to this webinar on homeopathy repertory, linking medicine, principles and patients, organized by our Homeopathic Science Congress Society in association with the Homeopathy 360 and HMAI Bihar. I appreciate the step being taken by Jain Publishers and thank Mr. Manish Jain, Director of Jain Publishers, for promoting education in homeopathy through their online portal. Today, I also recall meeting during our Homeopathic Science Congress 2008, organized on the occasion of 83rd birth anniversary of Dr. B. Sahani at Patna, where we had the opportunity to have live meeting with the Dr. Farokh, Dr. Frederik Schroyens. We all cherish your teaching. I am glad Dr. Amit Sahani, Dr. Frederik Schroyens, and Dr. Farokh Master for this event, and I am confident all participants will benefit from their lecture. I also have a special word of appreciation for Dr. Sanjiv Kumar Singh and Dr. Amit Sahani, who will be giving their presentation today. Repertory as a subject has been introduced into the homeopathic curriculum from the BHMS course. Since my student days, I have seen repertory as a tool for selection of simillimum. I have seen Dr. B. Sahani using Kent repertory, and it always created interest in my mind for this subject. Prescribing single medicine become very easy on consulting a repertorial after case taking. I firmly believe that transformation is a way of life in all fields. The transformation of homeopathic repertory in software for format symbolizes the digitalization of repertory, and all the same time makes this too more practical. Its use seems to be more effective in today's time with the advent of computers and mobile phones. Today, we have access to repertory on different digital platforms. I appreciate the initiative of Dr. Farokh Schroyens for his synthetic repertory. It is a treasure of information and complete reference book of homeopathic literature. Radar software deserves a special credit at this point for making repertory easier to practice. I have seen it.
I think some problem is there.
Yes, sir. You may proceed. I think yes, sir.
Just he is joining now.
Summarizing the things, I welcome you all during this 2 days webinar and wish you all the your thinking best. Thank you, sir.
Thank you, Dr. Ramjee Singh, sir, for your nice presidential speech, and it is just inspiring for all of us. Now, I request Dr. Farokh, sir, and before he starts, I give you a brief introductions about him. So it is the most pleasant moment for me to introduce a person who needs no any introductions. A world-renowned personality, Dr. Farokh Master. Most soft-spoken person whose heart and mind is filled with homeopathy and only homeopathy. Dr. Farokh Master was born on February 24th, 1957 in Mumbai, in India, and today I knew that he is just 4 years younger brother to me. Dr. Master entered into homeopathy in the year in June 1976 when he joined the Bombay Homeopathic Medical College after giving up his studies at the Orthodox School of Medicine. He studied homeopathy LCEH at the Bombay Homeopathic Medical College, and he was the India first MD who stood first class first and with the gold medal. Currently, Farokh Master has also completed his PhD, and I hope that he is one of the from the Bid College. He is one of the first PhD holder from that institution. He was the first Indian to be honored by the House of Lords, UK, for propagation of homeopathic system of medicine. Dr. Farokh has been independently practicing as a homeopathic physician at Mumbai Homeopathic Health Center over 29 years of experience in homeopathic consultations and treatment. He was the first doctor in India to introduce the homeopathy in allopathic modern hospital as well as in the private sector. He was the first to open the pediatrician department in the Bal Sarbali Wadia Hospital. He was the first to open a cancer department in Ruby Hall Hospital. So many first forerunner persons this man is. He was the only homeopath who was given the chance by the government hospital, King Edward Memorial Hospital, to open a homeopathic department. He is also a homeopath He is the only homeopath who has presented his paper on the efficacy of homeopathy in management of pain in cancer patients at the World Congress of Pain held in Milan in 2012. He has been recognized and acknowledged worldwide for his contribution in the homeopathic treatment and treatment of patients with cancer at St. Luke Clinic of Tumor, Switzerland, and Madame Curie Institute of Cancer in Paris, France, the Chicago Children's General Hospital, USA, etc. He has been the recipient of several national and international awards and honors for outstanding contributions to classical homeopathy, cancer and homeopathy, homeopathic educations, and other alternative therapies. Appointed as a medical inspector for Central Council of Homeopathy by the Ministry of Health and Family Welfare in 1995 and 2006. Formerly, he was a former professor of medicine, Maharashtra University of Health Science, Nasik, and he was also the member of the Central Council of Homeopathy. As a prolific writer, orator, teacher, and physician, Farokh Master has traveled to nearly 40 countries and making an average 12 to 15 international trips per year. He has been teaching the art, science of homeopathy, and he has several books with him, written by him. So he's a great contributor, and as I spoke to you earlier, that he lives with the homeopathy, he sleeps with the homeopathy, and his entire moment, every moment of his life is dedicated to the homeopathy. And with this introduction, I will request you, sir, to please start your presentations today. You are not audible, sir. Your voice is not coming up, sir.
So good afternoon, everybody. Thank you, respected Sahani, for giving me an opportunity to be a part of this wonderful event. I'm really, really happy to associate myself with your organization, with HMAI, and the wonderful list of speakers that we have in front of us. Respected Chairman Ramjee Singh ji, he's always there for, whenever I phone Dr. Ramjee Singh for any help, he's always there for me. We share the same birthday, 24th February. Anyway, thank you so much, everybody. Thank you, Manish, Jain, for supporting this webinar. Thanks, Yashika, for coordinating this webinar. Let's quickly go to the topic for today's seminar. Since there is a mass hysteria about COVID in the society and amongst homeopathic profession, I thought that I would rather talk today on clinical application of Repertory, especially in COVID cases, where I have used Repertory and how I have used Repertory and what drugs were useful to me. This is going to be my presentation. Now, I have treated cases of COVID in this pandemic, on some cases on internet, some cases in KEM hospital, some cases in my private practice. And I have helped so many homeopathic physicians who referred their difficult COVID cases to me. Some were very, very critically ill. And if time permits, I will discuss the case also. But primarily, I want to talk on the Repertory. Now, the most important Repertory which has been neglected so far is the Repertory by KNERR'S. So Kelvin KNERR'S, as you all know, that wrote this particular Repertory, what we call as from the guiding symptoms of Materia Medica, from the herring. So most of the stuff, the rubrics, the sub-rubrics, comes directly from the herring. And the best advantage of this Repertory is that the rubrics are not in a real form of rubric. when you compare with the Kent's repertory or synthesis repertory. The rubrics are in the form of the language of the patient directly verbatim. So that makes this repertory so interesting, because patient is talking directly in his own language, and that language is exactly given word to word, comma to comma in this particular repertory. So since time immemorial, I am using this repertory for acute illnesses. Some years ago, we had a very bad pandemic of H1N1 virus, if you all remember. And so many people died around the world. And I was trying to find out the cause of death. And in most of the post-mortem cases of H1N1, there was an inflammation of the tiny alveolar, tiny blood vessels that supply the alveolus. That was inflamed, and that's the reason why the alveolar collapsed, became necrosed, and the lung function was affected, and the patient died of respiratory failure. KNERR'S repertory came very useful to me in that pandemic of H1N1, where I could pinpoint exactly the symptoms of the autopsy report, and that autopsy report was inflammation of blood vessel alveolus. And the only remedy with that rubric was mercury solubilis. Can you imagine? I started using mercury solubilis in LM potency repeatedly in such advanced cases of respiratory failure, purely from that autopsy report of other patients who had died, and there was wonderful results. So Herring collected many pathological symptoms in his lifetime. In fact, 70% of Herring's materia medica is loaded with pathological and clinical symptoms. And all these are incorporated in KNERR'S repertory. And so that's the main reason why I refer KNERR'S repertory. And let us see in this pandemic of COVID-19, how this repertory was useful to me. So first and the foremost thing that comes to our mind is the hysteria about this COVID. So many patients come to my clinic with this fear. Some people already do COVID tests not once but multiple times. So many people don't want to step out of their house. So many people don't want to step out from their room, from their building, from anywhere, and they just want to be locked up in a jail. For such people, this is a very nice rubric, anxiety disease about, where there are only 7 remedies. And you will see nitric acid comes in a very big way. In my practice, nitric acid becomes a very important remedy for those people who are hypochondriac, think about their disease, who read about their disease on Google or on internet, who keep on visiting doctors for small things. This knowledge directly comes from KNERR'S repertory. The second is phosphorus, which is of equal importance. So you need to differentiate them, because nitric acid and phosphorus are very common even at mental level as well as at physical level. In both the remedies, you will see that there's a desire for salt, very important. And in both the remedies, you will see that they are sympathetic. Nitric acid is also sympathetic. But one is tubercular, another is extremely syphilitic. That's the main difference. So some of the syphilitic symptoms in the case will go in favor of nitric acid, and the tubercular symptoms. So miasms are very important to differentiate two closely similar remedies in my practice. Let's go to another rubric. Anxiety disease about with despair of getting well. So here you will see that patient has already the disease affected, they are suffering from the disease, but there is a big despair that they may not get well. Something will happen, some complication will happen. and they will be on ventilator. The biggest fear right now in many patients is intensive care unit and ventilator, that they will be admitted in a big hospital in ICU and they will be kept on ventilator. Here, I think so arsenic should be thought. So here I use arsenic a lot with this situation in an LM potency. Few doses reduces this anxiety totally. Apprehension of the disease. Now this is very important. Dr. Master, patients will say, yesterday I met a person with whom I had a cup of tea, and today I got the news that he suffers from COVID test positive. Now this is an apprehension that he will also get it. Or Dr. Master, I took money from a person yesterday and today I find out that he is COVID positive. So I touched the money which he gave it to me. This is a situation where you should think of Elapse and Lilium Tignium. So when you use KNERR'S repertory, you may come across common remedies in an uncommon way. But I tell you, if you use it properly, the results will come. So here, Elapse is a very important remedy. So apprehension for any disease, it could be a heart disease, it could be a lung disease, it could be an infectious disease. Elapse is a very important remedy. Apprehension future for and for her disease. Now see here, in Elapse it was only till disease. But when you think of Kali Cup, it is also for the future. So this is how the patient will say, doctor, I took the money from my friend. Next day he was COVID positive. Now I think I will have COVID for sure. And if I have COVID, what will happen to my children? What will happen to my wife? What will happen to my parents? What will happen to my family? There won't be any income. I will die very soon. And there will be financial crisis. And then there will be a lot of poverty in my family. See, he's talking so much about future. When this is the type of discussion, you should think of Kali Cup. Now, these are all the rubrics from their repertory. Please remember. Delusion, incurable disease, cactus. So here the patient is undertaking treatment from homeopathy or modern medicine for COVID, but he has a strong conviction that disease is not going to be cured. And all this treatment is useless. And finally, I have to embrace the death and I am going to die. Such situation will invite cactus glandiflorus. I use it in 30 potency when this is the situation. But as I said, not only for COVID, it could be for a heart disease, non-heart disease, anything. But there has to be an incurability, especially for those diseases which are easily curable. Then only it becomes an important. Incurable disease delusion, she has some organic disease and nobody is understanding the disease. Now this is very, very important. Person is definitely suffering from some disease for sure. So let's take an example how we can take it, this whole thing into clinical situation. So there was a man who goes for a party for his grandson's birthday. I'm telling you a real case. While after eating the dinner, he starts dancing with the family. Suddenly he collapses. So he collapses, people get worried, a general practitioner is called. And general practitioner frightens the whole family because of the hysteria of COVID, that this could be COVID, get him admitted to the hospital. The hospital refuses the patient to admit because they said, without COVID tests, we cannot admit. So you have to give blood for COVID tests, wait for results tomorrow, and tomorrow we will admit. But by tomorrow, it will be too late for this patient. And so, for that particular period, nobody knows what the patient had this fainting attack from. The patient was staying in my community or in my society. And when I come to know about this situation, about fainting, dancing, enjoying a birthday party of the grandchild, what was the effect on the patient? Patient starts thinking of COVID. Then he thinks that COVID is incurable. Then he thinks about people are dying with the COVID. And then he thinks, I read in the newspaper that vaccines are not going to help. I read in the newspaper that antiviral drugs are not helping the COVID patient. I read this, I read that. This friend told me this friend told me that. There is no cure for COVID. And now nobody has any medicine for COVID. Do you have any homeopathic medicine for COVID? Yes. For your situation, I said Lilium Tig. So this is the situation of Lilium Tig. This is a very interesting rubric in KNERR'S repertory. Depress about disease. So you are suffering from COVID and you are sad and depressed that you had to suffer from this disease. You can't go to work. You have to be quarantined. You have to stay in the hospital. Everything is taken away from you. You are just lying on the bed all the day because goes into depression. Think of sulfur. So sulfur is a very important remedy for such a depression due to any disease. Here we are talking about COVID. Depressed, but sure he is going to die within 24 hours. See, now here the time interval comes. Like Aconite, I am going to die. Please come. Like Thuja. Thuja also has the same feeling. I am going to die. Please come immediately. Stand near me. Sit near me. My time has come to die. Nobody knows of this remedy, Lec defloratum. Lec defloratum also comes very close to Aconite and Thuja, where this is the feeling that I am going to die. I am depressed and my disease will destroy me. So here you will see that you never heard of Lec defloratum. It's only through the remedy. And now we have to thank Dr. Frederik Schroyens here because in his PowerPoint presentation, he talked about that. A remedy which you cannot think of comes up in the repertory and you learn a lot about this repertory. Fear, disease of symptoms that indicate internal organic of approaching illness. The remedy is iris versicolor. Now this is so important rubric. There is an organic cause. Illness is going to approach and I have a strong fear of this disease. Many diabetic comes to me and when I'm treating the diabetes, they will say, Doctor, I don't want to suffer from kidney failure due to diabetes. Doctor, I don't want to have heart attack with this. Doctor, I don't want to have a stroke with the diabetes. So please treat me right now because I know diabetes is killing my organs every single day. And I got a great fear that one day I will have all the complications of this disease and I'm going to die. Think of iris versicolor, one of the best remedy for this situation. So here you can put the whole scenario instead of diabetes, remove diabetes and put the word COVID. And once you put COVID, you have everything in front of you. Then let us go to the some physical symptoms. So these were some mental symptoms. Because the time is not much, I'll quickly go to the physical. The heat in the eyes. Many COVID patients told me every day in the evening they get heat in their eyes, or every day in the morning they get heat in the eyes, or night. So heat in the eyes. Now whenever there's a symptom of heat in the eyes that is coming, my favorite remedy will be belladonna, china or lycopodium depending on the symptomatology of the patient. So I use this rubric a lot. It has only got 34 remedies. The advantage of KNERR repertory over other repertory is that other repertories will give many remedies in a big common rubric. But KNERR will give you a very small group of remedies. So I prefer to repertorize my case with KNERR repertory and the answer becomes very easy for me. Loss of smell with the COVID. Silesia and pulsatilla I have used so frequently in this epidemic, I can't tell you this. But there's a small remedy known as asparagus. So many COVID patients present with loss of smell and I give Silesia or pulsatilla. So if there's an extremely chilly patient, then I think of Silesia. Less chilly and wants open air, I think of pulsatilla. Smell diminish. So diminished smell, you will see a larger rubric. Your most common remedy that comes to my mind is Hepar sulf, Kali Bai. These are the two very important remedy. If they don't improve with Hepar sulf, Kali Bai on symptomatology, then I think of Helleborus, which is another very important remedy where smell is diminished. So these are the common things, smell diminish and taste diminish in COVID patients. Smell loss of and taste loss of. If you combine them, Hepar sulf, Hyoscyamus, Natramure. So this is a very nice rubric. Both things are lost together, smell as well as the taste. Hepar, Hyos and Natramure. Next. Then running nose with loss of taste. Many COVID patients had running nose, flu-like symptom, and the taste goes away. Again, we think of Natramure and pulsatilla. If it's a morning time, it's a sun aggravation, Natram. If it's an evening time, afternoon time, with open air amelioration, pulsatilla. That is how I differentiate. But it's a very interesting rubric, may not be found in all the repertories. Next. Nausea. Another common thing with COVID patients is Eupatorium purpuratum, especially if with nausea there is a thirst for ice cold water, or Natramure for sure. In a very big way. If it's a nausea is very severe, I always think of Natramure. Well, people may think of Ipecac and many other remedies for nausea during fever, but I promise you, you use this in COVID or malaria or dengue, severe nausea, Natramure, because he gives in 4 marks. It's a very, very important remedy. Try it out. And if it's a very acute fever, think of Bryonia. If it's a chronic fever, then more Natramure will come with nausea. That's how I differentiate. Both are thirsty. Both love cold water to drink. But Bryonia takes a large quantity of water and Natramure may not have that kind of large quantity of water. Vomiting, another very important thing. Again, Natramure. So vomiting and nausea with fever, my favorite prescription using NER repertory would be Natramuraticum. If the case does not respond, then I think of Eupatorium purpuratum or Elatrium. So these remedies, you will find that it is little difficult for you to understand if you are using other repertories. But if you are using NER, then this kind of prescriptions are very common. And I promise you they work because they are based on solid observation of Herring's guiding symptom. Influenza. So COVID word may not be found over there. So I use influenza. And I'm very happy to say that Bryonia comes. I tell you, majority of my cases have improved giving Bryonia. And here, I don't see arsenic. Arsenic was distributed in tons, like giving a chocolate to the whole population. And most of the people who received arsenic, especially police force and all other government agencies, so many of these patients came back with COVID positive. But I am not very sure of the prescription of Bryonia where it was given on the symptom similarity, and I think so it has worked wonders. Another remedy which has worked wonders with COVID is Gelsemium. And here you will see Eupatorium purpuratum also in between. But I would keep on stressing that if you have only few symptoms of COVID in your area, even 1 or 2 symptoms of Bryonia, give Bryonia. It is best for COVID-19. Now see here, temperature increase in pneumonia. So when COVID virus attacks the lung and the fever is very high, just today morning, I received an email that one of my COVID positive patient has a very high fever, 104 degrees Fahrenheit, and he was very thirsty. Antim Tat is the prescription. So very high fever and thirst, please think of Antim Tat. Especially when the lung is the root cause for the fever. So this is what I want to say. Lung is the root cause of the fever. Another very important remedy is baptisia. Now, baptisia is more for septicemia. So when you see a lot of septicemia and pneumonia and a high temperature, then please think of a remedy, baptisia. But with baptisia, you may also see that delirium of double and delirium of parts becoming loosened up and all confusion and all those things you will see a lot. And baptisia has got arnica-like symptom. The patient is talking few words and then he closes the eyes and goes to sleep. So when you wake him up again, he talks, but then he goes back to sleep. Another very important remedy for hyperpyroxia. Now see, in KNERR'S repertory, you have got temperature 103.3 in pneumonia. Do you know of any repertory which use exactly the same figure? No. So for hyperpyrexia, stramonium is another remedy after Antim Tat fails. So this is how you should use the clinical way, the best performance of a repertory. See, bronchopneumonia, lycopodium. So now you know stramonium, now you know lycopodium, now you know Antim Tat. They all are useful in pneumonia with a very high temperature. You need to differentiate them at the level of thirst, how they look, toxicity, and any other concomitant that exists with that. Next. So little background on afternoon fevers. Always start with belladonna. If no response, of course, creosote and arsenic comes into competition in my practice. So remember that, because there are only 12 remedies which Herring or KNERR'S mentions in the repertory. So yeah, depending on severe congestion, redness, thirst, belladonna goes into favor. But pale face, thirst, prostration goes into the favor of arsenic. And then catarrh, lot of discharge, offensive discharge and chilliness and afternoon aggravation, but not so characteristic thirst or anxiety or prostration. Think of creosote. So when there is a running nose and little cough and there is a fever, of course, bryonia comes in a big way, followed by mercury. Many bryonia people, you know, are good for a few days and then they develop symptoms of mercury and they need mercury solubilis. For catarrhal condition, they are extremely related and complementary to each other. But on the first day of fever, sometimes you also think of aconite if you get the typical exposure to dry, cold weather. But in pandemic like COVID, I think so aconite is not very useful as bryonia, as I have already mentioned to you previously. With cough, nitric acid, ferrum phos, calcarea phos. But I use ferrum phos a lot with fever cough. So it's a dry cough, it's a hacking cough. You hardly expectorate it. The throat is red and congested and the lungs will be clear. Nitric acid you use with that kind of cough where there's a lot of catarrh, lot of inflammation with the cough, then you think of nitric acid. Pale face ipecac. So since ipecac has got a clean tongue, remember pale face is ipecac. Pale face on sitting from the bed with the pneumonia goes in favor of lycopodium. That's what KNERR'S says in his repertory. But pale face with fever, think of ipecac. It's a beautiful concomitant of ipecac. Head, peculiar feeling. Patient cannot describe. You ask him, sir, mein kya hota hai? What is the problem in your head? He says, I cannot explain. When somebody says, I cannot explain in the head, there is a rubric given in the KNERR'S repertory, peculiar feeling, and baptisia is the remedy. Again, nausea with fever, eupatorium natrum mur. I told you, never forget this condition. You will be tempted to give ipecac, but if there is no clean tongue, then don't think of ipecac. Slow. So the fever is very slow, takes days. Take days to come up. Muriatic acid and rustoxicodendron. Now, rustox is also, I have used in a very bad case of COVID, and it has shown some wonderful results. But the fever has to be low and not a very hyperpyrexia type for rustox. Thirst, as I told you, you can look bryonia, netramure, arsenic coming very high, and if only these remedies fail, then only you should look for stramonium or pulsatilla. Now see, people say pulsatilla is thirstless, but KNERR'S repertory gives good marks to pulsatilla. People say stramonium is thirstless, but stramonium has a good marks in the KNERR'S repertory. So please keep into mind this particular repertory, which brings out many unusual remedies with a common rubric. Now, every cases you cannot use the same repertory. So sometimes we have to shift our loyalty to other repertories. So some important rubrics that I have used from synthesis. So many people have suffered from COVID and they have recovered, but they are not recovered so nicely. And that's why I give lycopodium. Now, Margaret Tyler was the first person who mentions about lycopodium with after effects of influenza. And COVID is almost like influenza. So I use a lot of advice of Margaret Tyler in post-COVID weakness or verism or languor. Conjunctiva inflammation with COVID, tuberculinum aviare. That's a very useful remedy. When eyes are affected, when conjunctiva is red, and there is a flu, think of tuberculinum aviare. Read Julian's Materia Medica, you'll come to know what I'm talking about. Now, these are the rubrics from synthesis repertory, not from KNERR'S. Or eye pain during COVID or during influenza, gelsemium, bryonia, and baptisia. Running nose from COVID or influenza, influenzinum, very nicely described in Julian's Materia Medica. Or red face with influenza, baptisia. In fact, baptisia is a very important remedy. Baptisia needs to be always compared with the closest friend, and that is gelsemium. Remember that. When you study baptisia, you should always compare gelsemium. When you study gelsemium, you should always compare baptisia because they come very close. Symptoms are very intermingling. But remember one thing, that gelsemium is slow and baptisia is fast and furious. Okay? Besotted is baptisia, as I said. Lot of ulceration in the mouth with influenza. It is entim tart. A very useful remedy like borax. With fever, you get inflammation in the mouth. Inflammation in the throat. Streptococcinum, another very useful remedy. When the throat symptoms are involved with influenza, think of streptococcinum. Parathyroidinum, when the pharynx is inflamed with the influenza. Sarcolactic acid, a wonderful remedy for severe retching. You know retching, you keep on vomiting and then you want to vomit and you retch and it does not stop. Think of sarcolactic acid. Sarcolactic acid is also useful for weakness accompanying the influenza or COVID. So again, violent vomiting accompanied by flu, sarcolactic. Try sarcolactic acid, I tell you, in your practice, where the vomiting is very violent and a person has a simple flu. Or influenzinum, if the trachea gets involved or larynx get involved, then think of influenzinum. Read this note from Julian's Materia Medica. Now, here we come to now little serious people who are in hospital, who are on ventilator. Use this rubric. There are 36 remedies. And asphyxia when the saturation decreases. In Bombay, everybody has now bought oximeter. Some patients bring their whole chart of oximeters. At 9 o'clock in the evening, the saturation was 93, then it was 96, then it was 98, is that. So when saturation drops, Entim-Tart, as you know, is our good old friend. Huh? Another remedy is also Entim crude. Very few people know that even Entim crude has got many symptoms similar to tart in respiratory illnesses. Another very important remedy is carbonium sulf. Remember that. Camphor, opium. These are some of the remedies when the saturation diminishes. Respiration interrupted very frequently in advanced COVID patients that I see in hospital. Hydrocyanic acid, a wonderful remedy, especially respiration gets affected in patients who also have convulsions. If that is the symptom, hydrocyanic acid is a wonderful remedy. And convulsions of hydrocyanic acid, you know that the eyeballs turn upwards. Huh? So that part is very, very important to know. Respiration arrested, as you all know. You think of snake remedies like Sankeris is a very, very important snake remedies, or Lachesis is another very important snake remedy, or Naja. Think of snakes. Then Cuprum, another very important remedy. But simple remedy would be also Bryonia in the beginning of the case. But in advanced cases, maybe you'll think of opium and other remedies. So this is a very nice big, large rubric where respiration is arrested and somebody wants to keep you on ventilator. Then, when advanced condition where there's a shadows in the lung and the patient is very critical, beryllium metallicum. Beryllium is a wonderful remedy. If you can see in this rubric, I have taken a photograph from the synthesis repertory. And tuberculinum aviare. These are my saviors. Huh? These are my saviors. Another will be carbon monoxide, another very useful remedy in this respiratory distress syndrome. So carbon monoxide, carbo-wedge, anti-Mars and Senega, especially when there's a lot of fluffy shadows in the X-ray chest of the patient. Respiratory failure, of course, start immediately aspidosperma or hydrocyanic acid or Laurocerasus, depending on the symptom, or Lachesis. I think so in this COVID thing, most of the time I have used Lachesis and hydrocyanic acid a lot to save so many patients from failure. When the paralysis of the diaphragm or respiratory muscle takes place, think of conium, please. If you read the poisoning of conium, you'll come to know what I'm talking about. Inflammation in the lungs that keeps on remaining and does not go away, think of anti-Mars. If that does not help, then again Baptisia, Gelsemium. See, you can see Baptisia and Gelsemium coming together. Next. Pleurisy type of presentation with influenza is Asclepias tuberosa and Simicifuga. Asclepias tuberosa is very well described in Borik's Materia Medica if you want to read. Again, palpitation and heart, Iberis. Iberis is another very important remedy. Then paralysis of the lung, total paralysis of the lung, so person is on ventilator. When patient is on ventilator, use this rubric, lung paralysis. Now here again Lachesis and Veratrum virate comes in a very high way. And as I've told you, majority of the patients in this season were helped by me by using just Lachesis in 50 millisiemal potency. Heaviness of the legs. Many people develop leg symptoms in COVID. I just use gelsemium based on the indication given to me by Margaret Tyler in her book under the remedy gelsemium. Redness of the toes. Many COVID patients had red toes. The first symptom of red toes, I give carbo-wedge because the oxygenation drops down. Giving carbo-wedge improves the oxygenation. So I use lot of carbo-wedge when the toes are red in color. Blue in color, sickle core. When there is a blue color, I think of sickle core. Remember that. Redness of the finger. When there is a redness of the finger, think of agaricus. Another very useful remedy, especially with influenza, but agaricus also has got cold weather affections. If agaricus fails, then think of nux vomica and lycopodium. Sleepiness. Patient wants to sleep all the time with fever or without fever. Baptisia gelsemium. You saw how closely these remedies are working. Baptisia and gelsemium, which I just described to you. Profuse perspiration. Amyl nitrosum. When sweat comes as a big concomitant, think of amyl nitrosum in COVID patients. Convulsions. You have already recovered from COVID, but you are not 100% better. Think of cadmium. Cadmium and sorinum. And if these fails, then Sclerotinia mother tincture I use a lot for ailments from convulsions after COVID. Muscle pain, simici-fuga, after COVID or with COVID also. Pain in the nose. So shooting pains in different part of the body. With COVID, again simici-fuga. Restlessness is pyrogen with COVID. Paralytic weakness, Baraita mure. Read Borix Materia Medica, very well described in the remedy Baraita mure, paralytic weakness especially. And then laboratory investigation, D-dimer. So D-dimer is increased. Then you think of most of the snake remedies, Botrops, Botrops etox, Botrops urutu, Cantharis, these are all animal remedies. Lachesis, Vipera. So D-dimer. We have a repertory, go under generals, laboratory findings and look under D-dimer. Next. Thrombosis. Lot of thrombosis happens in COVID in advanced condition. Again, most of the drugs are snake remedies. You can see Bitis, Gabonica, Botrops, Crotellus horridus, Lachesis, Vipera. Lot of snake remedies comes in thrombosis. Leukocyte decrease. Many COVID patients have got low white cells count. So you should think of remedies like cisplatin, carboplatin, Lachesis, flutamide, Botrops etox, Aurum, Botrops jararaca, the snake remedy. Platelet diminish, Hirudo. Very useful remedy in my practice is Hirudo. Rubia tinctora, another very rare remedy. Polypus, another very rare remedy. X-ray, alpha-alpha. These are some of the remedies that are very useful when the platelet drops down very the critical way. All these remedies can help you. And then general anemia is a large rubric, so I am not able to tell you anything. It's a very, very large rubric of 200 plus remedies. And COVID-19 or H1N1, this is a nice thing that I made. Remedies that I have used in this pandemic, I made a rubric out of it, COVID-19. So these were the things which were very much useful to me in my practice, especially mustard gas, carbon monoxide, kali mule, phosphorus, tuberculum aviare. And you will see bryonia in a very big mark. So remember bryonia. This pandemic needs bryonia. Thank you so much. I think so this is enough for the day. I would like to really thank you all for giving me an opportunity to share my work with you. Thank you, Dr. Ramjee Singh. Thank you, Dr. Midul Shani. Thank you, Dr. Frederik, for all your support. God bless you all. Bye-bye.
Thank you, Doctor, for your very wonderful presentations. And it was such a practical approach that you Farokh, sir, for your and we are always supported by you, and I hope we'll be receiving many from you. You are a provider, and every time you are and encouraging and guiding all of us. So with this, now we want to move to our who are coming from the junior cadets, and the most junior cadet speaker presenter is I think Dr. Amit Sahani is present in the.
I'm waiting for my.
Sir, just give me a second.
Yeah.
Give me a second. Sir, there is a
Hello.
question from Dr. Frederik. Can we discuss for a minute? By the time I just upload the presentation again.
I have uploaded mine.
Hello? Sir?
But, yeah, what you say, sir? What you say? Hello?
Sir, I'm just saying, Dr. Yashika, I'm just saying Dr. Frederik has a question. By the time Dr. Amit Sahani sir starts, we can discuss one question. From
Okay,
Dr.
sir.
Farokh, he is asking.
Yeah, please. Most welcome, sir. By the time he
So,
uploads
Dr. Farokh sir, Farokh sir, I hope you are with us. So, Dr. Frederik wants to know one question: is bryonia more effective, more often indicated in COVID than gelsemium in your clinic? Dr. Farokh sir? I think he is not here. We can discuss at the end when he joins.
we might have left,
Dr.
sir.
Amit Sahani sir can continue. Yes, sir.
So, Jessica ji, can we start with the introduction?
Yes, sir. I think we can start because Dr. Farokh is not there. Shayad.
But, yeah.
It's okay. You can start, sir. You can start with Dr. Sahani sir's from
Okay.
introduction.
So, now I am going to introduce Dr. Amit Sahani. It is my pleasure, an emotional moment for me to introduce my own son, Dr. Amit Sahani, who seems to have imbibed the hereditary chromosomal features of homeopathy from his legendary figure in homeopathy, Dr. B. Sahani. Living with the homeopathy as being born within its arena, Dr. Amit opted homeopathy as his career. He was selected for admission in the most premier institution of the world at National Institute of Homeopathy, Kolkata, where he learned his learning was blended with academic background. Immediately after his BHMS at NIH, he joined the MD course at GD Memorial Homeopathic Medical College and Hospital, Patna. And after that, he joined as a lecturer in the Department of Repertory at the GD Memorial College. And later on, He was selected by the Public Service Commission for lecturer at the Government Homeopathic Medical College, RBTS Government Homeopathic Medical College, Muzaffarpur. His keen interest in learning and thirst for knowledge made him to be selected for PhD course at MK Bhavnagar University, where he completed his research project and was awarded the PhD degree. Constantly living with the educations within the house, in the clinic, and at the college made him to live with homeopathy. Dr. Amit has visioned about the dimension of study required for PG in homeopathy, which made him to write conspectus covering the basic subject of man in health, disease, and research methodology, which was widely accepted all over the country. Dr. Amit has been actively working as the Director Research Institute of Sahani Drug Transmission and Homeopathy, and kept on working for the extension of dynamic philosophy of homeopathy. His interest in pursuing discovery of his grandfather, Dr. Amit Sahani, transmission of homeopathic drug energy from a distance, made him to work and bring homeopathy under the scope of telemedicine. His articles published in peer-reviewed journals are of great importance for the homeopathic education system. He is the resident editor for Homeopathy, peer-reviewed journal published quarterly. Dr. Amit has presented seminars on various national and international seminars. His poster presentations at HMAI Congress and held at Brazil was highly appreciated. Dr. Amit's activity at social level rose him to be the General Secretary of the Homeopathic Medical Association of Bihar State Branch. His sincere effort in nurturing homeopathy, which is inherited, proved to be the most natural for him. Today, he is going to present on the strategic approach to the homeopathic report. Now I ask Dr. Amit to start his presentation.
So thank you very much, sir. I take this opportunity to seek your blessings. Good afternoon, everybody. Dear doctors, admirers of homeopathy from all over the world, I welcome everybody to this Globinar on homeopathic repertory, linking medicines, principles, and patients, organized by Homeopathic Science Congress Society, Homeopathy 360, and HMAI Bihar. Thank you, Dr. Yasika, for the support to this event and to all the events that we have been organizing. Thank you, Mr. Manish Jain, for organizing such events and promoting the cause of homeopathy. The services of BJN Group for the homeopathic fraternity is an inspiration in itself. Respected Dr. Ramjee Singh sir, President HMAI, respected Dr. MK Sahani sir, both of you have always been a pillar of support and remain to be an inspiration for a generation of homeopaths. My greetings to Dr. Frederik Schroyens, Dr. Farokh Master sir, Dr. Sanjiv Kumar Singh, and everyone present in this august gathering. It is really a privilege for me to be part of such an event. I'll be discussing on the subject of strategic approach to repertory in homeopathy. So as we are aware of different schools of thoughts in the repertory, a strategy is a must. We must develop a